Good morning, good evening, good afternoon, everyone, depending on where you are. On behalf of the International Pharmaceutical Federation and the Global Pharmaceutical Observatory, I would like to welcome you all, to those who are joining live, and also to those who will be watching this webinar afterwards. I would like to also warmly welcome our guest today, which I will shortly introduce. We are pleased to be delivering this regional digital event as part of the FIP-GPO program entitled How Can Digital Health Support National Pharmaceutical Care Delivery? A regional and global assessment of priorities and challenges in the Southeast Asia region. This is a series of 6 regional events, and this is the 4th regional event that we will deliver today. I would like to introduce myself first and also introduce my co-moderator today. My name is Shirley Melianti. I'm currently the FIP Data and Intelligence Specialist, and I will be moderating this session with Dr. Taniru V. Narayana, who is the President of Southeast Asian Regional Pharmaceutical Forum. We will be moderating this webinar together. And before we begin, I would like to share some announcement. This webinar is being recorded and live streamed via YouTube, so feel free to watch it afterwards. The recording will be also available in our website, events.fip.org. You may ask questions using the questions box provided. So there is a Q&A box, which you can type your questions directly. And feel free also to greet everyone in the chat box. You are also welcome to provide feedback to our email, webinars@fip.org. And if you are not already a member of FIP, I would like to invite you to register to become our member by looking at our website, www.fip.org/membership registration. And you will be also receiving a certificate of attendance from FIP after this event. And before I start, we also would like to thank Pfizer and Partnered for Better for supporting this program through unrestricted funds. And we also would like to acknowledge the support of the FIP Global Observatory team, who is responsible in the management for this program. And without further ado, I would like to welcome the FIP lead for Data and Intelligence, Christopher John, to provide some information about FIP Global Pharmaceutical Observatory. Chris, the floor is yours.
Thank you, Shirley. Hi, everyone. I'm Chris John. I'm FIP lead for Data and Intelligence and also the Secretary of the FIP Data and Intelligence Commission. I'm a UK registered pharmacist. You'll see on this slide the FIP Global Pharmaceutical Observatory's mission is really around data, as we've said, intelligence, advocacy, and reporting. The FIP Global Pharmaceutical Observatory is the engine room of global pharmaceutical data collection, and it will monitor and measure progress towards the FIP development goals. Its mission centers around data, intelligence, advocacy, and reporting, as I've said, and we know the importance of data. The pandemic, the COVID-19 pandemic has shown us that. And this important data will provide us with evidence which demonstrates impact. So our first task is to collate valid global data on workforce, education, practice, and pharmaceutical science. And we must undertake comprehensive analyses of collated data to provide accessible, high-quality intelligence. And all this must be communicated innovatively to promote our member organizations' impact on health. This communication will often be via the FIP Atlas, which is our visualization platform for displaying our data and intelligence across the globe. Finally, we will provide evidence-based strategic information, reports, and guidance on the application of pharmaceutical science, policies, practices, and services. On the next slide, you'll see some of the work streams that we currently have underway within the FIP Global Pharmaceutical Observatory. We will continue to take a tried and tested needs-based approach to addressing data and development goal challenges through the development of an inclusive multinational needs assessment program, which today's event is very much part of. As I've said, the FIP GPO Atlas is a platform for showcasing our members' needs and priorities, supported by data from the GPO. And so, for instance, data we collate about digital health can be displayed in a very innovatively exciting way on the Atlas. And this will allow FIP to identify opportunities for developing pharmacy with, for, and through our member organizations. The GPO database is the repository for FIP's pharmacy and pharmaceutical science data. We've been building that over the last year or so. It contains data that inform the indicators that will be used to track progress against the development goals. And the FIP development goals provide the framework for needs assessments and prioritization for member organizations to undertake relevant to their national situation. In turn, the priorities can provide each organization with the foundations for mapping the progress and transformations for their workforce, practice, and pharmaceutical sciences. Indicators will be a way to measure and monitor progress and transformations for their workforce, practice, and pharmaceutical science against the development goals by the data we collate in the FIP Global Pharmaceutical Observatory. And we have some events coming up in October that will be describing how development goal indicators can be used to measure progress. The Data and Intelligence Commission provides strategic advice to FIP on the advocacy and delivery of the GPO project, focusing on achievement of the vision and the strategic objectives through member engagement. So that's a brief summary of the work of the Global Pharmaceutical Observatory. If you would like to know more, please do visit our microsite, and the address is given there, or alternatively, you can scan the QR code. So thank you very much for listening and enjoy the rest of the event.
Thank you, Chris, for sharing information about the Global Pharmaceutical Observatory. So as Chris mentioned, one of our program is Multinational Needs Assessment Program, and today's program is a part of Multinational Needs Assessment Program, which the title is How Can Digital Health Support National Pharmaceutical Care Delivery? And we will be focusing today on medication adherence and fighting substandard and falsified medicines. We know that substandard and falsified medicine, along with a lack of adherence to medication regimens, can create a threat to public health worldwide. So that is why now we discuss about that. And as you all are aware, perhaps everything now is digital. So it is possible to deliver pharmaceutical care services that address the challenges related to substandard and falsified medicine and medication adherence using digital healthcare technique and approaches. But digital health also can face many challenges and concerns, despite its potential to impact pharmaceutical care in a good way. And again, that is why today we will be discussing about that and to discuss about how we can tackle this together. So this regional and global needs assessment program will include a series of 6 regional events, which we will close with a private global roundtable and a summary report afterwards. We have delivered 3 events before, which is the Africa, Eastern Mediterranean, and also the Europe region. And today we will focus specifically on Southeast Asia region. And the aim is to facilitate the discussion, to share the ongoing initiatives, the drivers, and the challenges of pharmaceutical leadership bodies and nations face in integrating digital health into pharmaceutical patient care. And the emphasis will be the use of digital health in medication adherence and fighting substandard and falsified medicines. And this is the webinar outline on what you all may expect from today's webinar. So we are now in setting the scene phase where I introduce the program briefly. Following this, we will move to our discussion with national leaders from the region, where we will divide into 2 different teams, medication adherence and substandard and falsified medicines, which lasts hopefully in a total of 30 minutes each. And then we will also have some activities actually between the teams to engage all of you who attend today's discussion. So be ready to share your views with us. And I will now give the floor to Dr. Narayana to facilitate the discussion of the first team. Dr. Narayana, the floor is yours.
Thank you, Shirley. Oh, sorry for joining late. And I am Dr. T.V. Narayana, President of CR Pharm, with the moderator of this session. And let us go with the flow, the theme 1, digital health to support medication adherence. And on this platform, I would like to welcome our panelists, Dr. Rao Wadlamudi, President of Indian Pharmaceuticals, past President of Indian Pharmaceutical Association, and Hilwan Yoda Cheruna, Indonesian Pharmacists Association Vice President, and Kalam Jayasuriya, Pharmaceutical Society of Sri Lanka's President. And I welcome all the panelists, and their biographies were there in the chat box. I request the members who are present, they can go through the biography in the chat box. And I request all the speakers to switch their cameras. I think all they have switched on their cameras to start the panel discussion. And we'll start sharing the screen. And I have to ask the questions to all the panelists. And question number 1, the ongoing initiatives. Does our country or organization provide any digital health applications or interventions that facilitate medication adherence as part of the pharmaceutical care services? Can you provide an example? To start with, we'll start with Dr. Rao Wadlamudi.
Thank you, Dr. Narayana. This is Dr. Rao Wadlamudi, Professional Secretary of CR Pharm Forum, immediate past President of Indian Pharmaceutical Association. It's a great topic, digital health, and how would that influence medication adherence? In vast countries like India, where the challenge still for the government is to provide quality medications under quality pharmaceutical advice to all the patients situated all across the country. If I have to answer, how much of digital health applications are available? It's a very difficult question to answer. I would say that in some corporate hospitals, in certain patient pools, in certain big cities, probably some digital health applications are available to monitor patient medication adherence and outcomes. Okay, but not in a widespread manner. Okay, usually handheld blood pressure meters and glucometers and other devices are used to monitor the status of the what you call non-communicable chronic diseases like hypertension or diabetes. That would help adjust the medication, adjust the prescription, and thereby bring in medication adherence. This is a general example I can tell. Nevertheless, the government can really implement digital interventions. I can give you an example here. During the COVID pandemic, Government of India, Ministry of Health, and its information, IT departments have created digital applications, mobile apps to monitor the spread of the disease, an app called Arogya Setu. Using that, actually you are aware of at what situation you are located in, how many COVID positives are around you, and what is the density, such that you can take precautions to prevent yourself from exposure. As well as government created a portal through which people can register and get vaccinations. And mind you, using these applications, which is called CoWIN application, 2 billion vaccinations have taken place in this vast country. vaccination, the time booking, and you go there and you get your vaccine. And then in 2 days' time, you can download your digital application. Certificate. Now, this clearly indicates that the government can implement several initiatives to introduce digital health. Okay, that's what I can say. But is it widespread in the country? No, it's not yet. It still takes a long time to use digital health to really monitor patient, medication adherence in patients. Back to you, moderator, Dr. Narayan.
Thank you. Yeah, thank you, Dr. Rao, for the such scenario, particularly in India. And now I request Dr. Hilwan Yoda Teruna, as President of Indonesian Pharmacists Association. Please, sir. You have to unmute. Hilwanji, you have to unmute.
Oh, sorry.
Yeah.
Thank you, Dr. Narayana. And this opportunity, I would like to thank for the FIP inviting me again for these occasions. I would like to share some of our experience especially during the COVID-19 pandemic. I think we are not far from the experience of what happened in India, that as mentioned by Dr. Rao before. Starting in 2018, actually, the Indonesian Pharmacists Association has established a database which is consists of the members of pharmacists all over Indonesia. Then back in 2020, the government of Indonesia has released a law regarding the service online for medicines. It's called PSEF. This regulation has made the growing of the application, especially in the treatment of patient and also delivering the medication to people. I would like to categorize three types of application that developed by people. First is application developed by providers such as pharmacies or hospitals or even the government official. The other is application developed for professional such as pharmacists. And the other is applications developed for patients. In terms of the first question, the adherence of patient for using the medication, it is important for us in giving a good pharmaceutical care. Currently, application developed by many producers, including health institution or education institution, such as the most application that I found in the apps in Indonesia for patient is for diabetic controls and for hypertension or high blood pressure. That's the two most application that available for Indonesian. How about in Pharmacists Association itself? We currently develop mobile application for getting information from the our members who has experiencing with the this adherence as well as for the counterfeit products. So I would say that we are in developing of everything, but this is in good way. It's on the track actually in developing of the application. I think that's all from Indonesia that I can share with you. Back to you.
Thank you, Hilwan Yoda. Now I request Kalam Jesuria, Pharmaceutical Society of Sri Lanka, to do his remarks.
Hi, Dr. Narayan. Good to see you after we met at Colombo in our Golden Jubilee. Hi, everyone. I think I totally agree with what Dr. Rao just mentioned, because being our immediate neighboring country, during the COVID, of course, even the government has developed the apps like for people to be more compassionate with, to find out where the affected people are. But coming to our topic, the key topic on the medication adherence, of course, I would like to discuss in two aspects, mainly because I actually am heading the pharmacy operation of the private sector, which has about 6-7 hospitals. We do, started doing many things by using digital platforms, but unfortunately, when it comes to the government, because we may be doing just less than 1% of the medication requirement of the country. So the rest is mainly at the hands of the public sector. So, but one good thing happened during the COVID is like all these community pharmacies, they start sending, at least using WhatsApp on this. But in contrary, I really feel because whether this has been, kind of initiated some kind of irrational use of medicine as well, because people start using the community pharmacies without prescription sometimes, just sending SMS, especially I'm talking about the misuse of antibiotics. But to address the question, what you asked is, at the private sector, of course, we do follow up even for the discharge medication. I just want to say, because I'm working for the hospitals, we do have a follow-up system for special needy patients, especially after CABG, kind of heart surgery. After 2 weeks, actually, we send them certain kind of information, and that's mainly to the phone, but still we have an app developed. Even we practice the telepharmacy, where even the patient can track where the medicines are and at what time it was dispatched. But only thing, unfortunately, we don't follow up with them. And one more thing is, we just recently we started in our hospitals, because I'm talking on behalf of hospital, because I have nothing to take up here nationally. But we start doing an app to manage antimicrobial, kind of for the antimicrobial stewardship. So that app is not only for the doctors, and that we are trying to extend it to the use of patients as well. So that's from Sri Lanka, Dr. Narayan, about for the first question you asked.
Thank you. Thanks to all the panelists for giving their opinion. And as rightly pointed out by Dr. Rao, this digital health concept, India is way behind, and it was not covered in the curriculum also. I think the regulatory bodies are looking into this and giving a serious thought, introducing the chapters or topics on digital health and training the students and pharmacists on this. That was initiation started in India. And I'm happy to listen in Indonesia, the apps, excellent. They have come out applications for regulators and even pharmacists, and even for educational institutions. They are way ahead in terms of support of the digital health in medication adherence. And and some questions and in Q box I have seen, and one is particular to Indian scenario. Which regulatory requirements needed in India for this medication adherence? Dr. Rao?
Which
regulatory
from a regulatory perspective, you need to rewrite the entire Drugs Act, because you have to introduce all these aspects. Digital health means several things would be done online. So the point of care devices, diagnostic tests, and then you upload them, and the clinician would look at them and prescribe, and an online pharmacy would dispense them, and then the medicines reach the patient, and a pharmacist is available to tell him how to use it and monitor, and then the outcomes and the medication adherence is fed back into the system. So it's a whole gamut of things that are not done on physical contact. So the regulations have to take into account all these aspects and have to be built. Sometimes in India, what happens, some of these regulations are so old that they apply it, then online pharmacy becomes it is a banned activity. It cannot be done, But then today, digital India wants everything online. So there is a conflict. So the regulations have to be made with an intention to introduce digital health as a main pillar of pharmaceutical care delivery system in India. So work is a lot more what needs to be done, Dr. Narayana. Thank you very much for giving me this opportunity.
Yeah, thank you, Dr. Rao, because as you informed earlier about the Arogya Setu app, that is a wonderful digital tool introduced by Ministry of Health, Government of India to track this COVID-19 vaccination point of view, and even the exposure of the patients nearby within this app. So Ministry of Health and Family Welfare and Government of India, if they come forward with the regulators, definitely in future with the experience and the expertise of our friends from FIP, they can guide us to implement this digital health to support medical adherence in developing countries like India and Indonesia. Thank you for all the panelists, and thanks to all the panelists for their valuable inputs. And now I will hand over it to Shirley to start the engagement activity with the adherence. Shirley, it is over to you.
Oh, apologize. Just realized that I'm muted. Thank you, Dr. Narayana and all of the panelists. Perhaps if it is okay, I would like to bring, before I move to the engagement activity, I would like to also ask a question actually about the medication adherence, because this has been a very good discussion. So I have a question about, so we discussed already about the ongoing initiative. We also somehow discussed a little bit about the barriers and challenges, but perhaps if the panelists can mention a little bit about the apps which is focused on the medication adherence. Can I ask perhaps Dr. Rao for the first to let us know, is there any digital health focus on medication adherence in India? And if there isn't, what are the barriers to integrate and mobilize this digital health intervention related to the medication adherence? Dr. Rao, is it possible?
Yeah,
thank you.
Yes, I realize that we haven't talked about the barriers and challenges and what are the drivers to do this. But to be very honest, in a country like India, the barrier is having a pharmacist behind each medicine dispensed. So we're still trying to have medicines dispensed only by pharmacists, meaning that medicines are dispensed, but not by pharmacists. Then in that scenario, how can I think about an app that would talk about medication adherence? Medication adherence is when a prescription is given and patient takes the medicines and is he adhering to the regimen and taking his medication regularly to get a favorable outcome. That's what is medication adherence. So it would be ideal, like maybe a smart pill box, or a reminder that he should take the medicine, or if he doesn't open the pill box on the time, then there is a reminder saying that you are skipping a dose. All that are ideal things to be introduced into the healthcare system. But in a vast country like India, yes, the affluent, the people who are in metro cities and who are going to corporate hospitals and have access to pharmacists would immediately take these things and then start applying it for their healthcare benefits. But how about the vast rural population, and what can we think about it? So this is something, a big, huge challenge that we need to overcome. Then I will go on to talk about what are the drivers. The drivers again is government policy implementation, having the pharmacist, and Dr. Narayana said, train the pharmacist at the school level or at the college level about what is meant by digital health and how these interfaces would work. Tell all the healthcare professionals to work in tandem. How many times all the healthcare professionals are working in tandem? That is the prescriber, the pathologist, and the dispenser, and then the person who is looking at outcomes evaluation, and all sitting together and talking. So all that can be, introducing them could be drivers. I believe that a public-private partnership where government and private will have a collaboration to introduce digital health in a small region in India, and a model that when it's implemented, it becomes, you can monitor the success of the model, and the model should be scalable such that then you can expand it to the entire country. And if that is accepted by the government and a policy is made and the rules are defined and regulators understand this, that is the beginning of implementing digital health into medication, adherence, or patient making better healthcare. So for that, first we have to put a quality pharmaceutical care in the healthcare system. So this is what I go back to this. What we need to do, and the next level and the next level, next euphoric level is digital health. But with governments, if there is will, they can do it, just like they have done during the pandemic, controlling everything online, So for this, a policy and then a good implementation is necessary. I hope I covered the entire thing from this perspective. Thank you very much.
Thank you so much, Dr. Go ahead.
I will add up a few things for this, Dr. Rouse. Oh.
No problem. You can go ahead. Yeah.
Actually, 70% of population in India are from rural areas, and accessibility of medicine is the biggest challenge in previous years. All the previous years, now at least the medicine are accessible to even rural mass and rural poor, thanks to industry personnel and community pharmacies. And this medication adherence, people are not aware fully about the adherence, about the side effects if they discontinue or inadherence in the medication comes and all. First, awareness program should be given, and a training to the community pharmacists should be given. Here, hospital pharmacists has to play a major role, no doubt in it. And it is a good platform. IPA, Indian Pharmaceutical Association, or through CRPharm Forum, they can take a lead and train the pharmacists first and create awareness among us, the rural mass, about the NCDs, particularly about the NCDs and advantages of digital health and how much it is going to be beneficial for the patient. Because of medicine waste, earlier FIP has come out with a big statistical data 2 years back about more than $400 billion of medicine wasted unnecessarily because of inadherence. These are some of the things who can take the help of our good friends, the developed countries, and we can train and create awareness, particularly from Indian point of view through SEER Farm Forum. That's what. Both you, Shirley.
Thank you so much, Dr. Narayana. So what I can see from the points that highlight in India, basically, it's like the barrier is lack of government policy, a need for partnership, and also education and training of pharmacists. That's the most important things. And I would like to invite Dr. Hilwan to say if Dr. Hilwan agree if this is kinds of like a challenge in Indonesia, and if there is any additional barriers or enablers that Dr. Hilwan would like to add. And I will go to Dr. Kellen afterwards. Thank you, Dr. Hilwan. Dr. Hilwan,
Yes.
the floor is yours. Yeah.
Thank you, Dr. Melianti.
Thank you.
I would like to say what happened in India is also happened in Indonesia, actually. As you know that we have 270 million people in Indonesia. And I believe you do agree with the number of islands in Indonesia here. It's more than 16,000 islands we have in here. The big problem for the area like that, it's so remote area. We just cannot be connected by 3G, 4G connection. So it means that we don't have internet connection in those areas. The lack of the internet connection will be the biggest problem in Indonesia. I don't know, in India, mostly terrestrial connection, I guess. But in Indonesia, some of area has to be reached by satellite communication. So the other problem, I would like to say that digital literacy, especially for the elderly, is a big challenge for us. So it's the barriers, especially recently, people who only have like 2 or 3 children, and then they grown up, and when they are all gone from the house, the only friend they have, only a small family, parents and mom and dads who doesn't have any good literacy in computer. So digital literacy is one of the biggest challenge. The other thing is the distribution of pharmacies in Indonesia. Most pharmacies, I guess, based on my data, it's about 90% they live in Java Island, which is Jakarta, Bandung, Semarang, Yogyakarta, and Surabaya. So it means that we don't have people who can help. We don't have pharmacy who can help people in the remote area. So I would like to say that what can drive the changing of the literacy in digital or even in the services. I guess one thing is we have to change the curricula in the educational institution. That one is must be changed immediately, because the COVID-19 pandemic has changed many things in our life, including the how to connect to each other. I guess that's all, Dr. Melianti.
Thank you, Dr. Hilwan, for sharing and adding to the points. It's well noted. And perhaps because of the time, I would like to invite directly Dr. Kellum to share, if Dr. Kellum would like to share if this is the same problem, or if there is any additional points that Dr. Kellum would like to add. Dr. Kellum, the floor is
thank you,
yours.
Shirley. Yes, I think most of the points are very much similar to Sri Lanka, but as you all must be seeing in the news, we have a new issue with the Sri Lankan forex issue and the high inflation. In fact, on this 4th, they have increased the tariff of all the communication providers by 25%. And it's not going to be a easy thing for Sri Lankan farmers. And in terms of education, what Dr. Hilwan said, in Sri Lanka, I think we are the, I think, we are the only, country in the region, I think, where the pharmacy, registered pharmacists are coming with a part-time kind of a course, because 95% of the community pharmacy, only few graduates are in practice. So it's kind of a major issue for the country, because if you see the curriculum, because they study on a part-time basis, just a couple of hours per week. So that, but ultimately after 2 years of registration, they get the certificate as a pharmacist. But I feel like if you compare the knowledge gap they have, so that I think FIP hopefully they will focus on Sri Lanka, because I feel that education is one point where we need to improve in Sri Lankan pharmacists, because to go for the next level. I know the time is kind of a factor here. So that's it from me, Shirley. Thanks.
Thank you very much, Dr. Kelum. Dr. Narayana, I think that's a lot of things to do for the Southeast Asia Forum. And FIP for sure. And we will support Sri Lanka, Indonesia, India, and also the other countries in Southeast Asia as well to implement the digital health. And actually, I also can see there are a lot of ongoing chat where some pharmacies, thank you, Wira, to share information about what happened in Thailand. And also there is another one as well from Malaysia. So for audience, please do, if you have any comments or any question, if you have any questions, go to the Q&A. But if you have any comments, please do share in the chat. And this is very valuable input for us to develop our program further. So thank you for that. And I think I would like to move now. I will share my screen again. I would like to move to our engagement activities. We will be having a poll where we would like all of you to share your opinion. And if you look at these challenges, somehow also related to what we have discussed as well earlier. So we would like to ask you all to share your opinion. What is the main challenge to implementing digital health in pharmaceutical care services? And you can answer the top 3 of these following options. And if you would like to provide more clarification, feel free to type in the chat box. And the first option, as you can see here, is a lack of regulatory models, policies, and strategies. And this is related to lack of regulations to ensure the safe and effective use of digital health. The second option is related to economical and financial concern. We also discussed about this earlier as well. So perhaps this is related to the cost for the digital health implementation is high. And the third option is patient confidentiality, risk, and safety. And this is regarding how we manage the patient information security. And the other thing is about variable technology literacy and accessibility in the community. And we also somehow discussed this in the earlier team as well. And we know that not all communities perhaps didn't know how to use or access the technology. And the fifth option is a lack of professional learning and training for pharmacists in digital health. The next option is a lack of evaluation mechanism and monitoring of digital services related to a lack of monitoring tools and mechanism to evaluate the use of digital health and its effects. And the last option is the lack of interoperability of systems related to a collaboration with other systems. So we would like to invite you to identify the top 3 main challenges in your country related to the implementing digital health in pharmaceutical care services. And perhaps we will give you around 30 seconds more to answer this. And I think we can close the poll. Okay, here it is. Really interesting, the result. So as you can see here, actually, the top 3 of our audience today reveal that first, the lack of regulatory models, policy, and strategy. So, Dr. Narayana, and perhaps this is mentioned previously as well by Dr. Rao. So, interestingly, it is also one of the most challenges that mentioned by audience today as well. And the second, this is also related to professional learning. Yeah, and literacy. What do you think, Dr. Narayana? I think it's more or less.
That's true. That's correct, because particularly in Southeast Asian region, the curriculum was not updated with the upcoming areas like digital health or telehealth. This is a need of the day, and no doubt in it. And as a professional body, we need the regulatory support, the government support. Then only we can implement, we can see the changes, particularly in the areas of digital health. These two, definitely, I will fully agree with the audience for their choice of reference, first and second.
Yeah, and I think this is also good opportunities for us as well, because these three challenges, something that perhaps we can develop together, we can advocate together. So yeah, hopefully we will implement the digital health to support us, to support the pharmaceutical care services in the future. Okay,
Certainly. I think Dr. Rao suggested we can take up this as a pilot project, start in a specific area of one region in Southeast Asia. We can start as a pilot project, and then we can approach the government or regulators and we can influence them based on the outcome of this pilot project. That's what I can suggest.
Sure. Thank you, Dr. Narayana. So now we can move on to the second theme, and I will hand over now to Dr. Narayana to facilitate the discussion.
Yeah, thank you, Shirley, and thanks to all the panelists for their wonderful discussion on the digital health and medication adherence. Now we'll proceed to the second theme, that is digital health to fight substandard and falsified medicines. This is one of the wonderful topic chosen. Now we have with us Dr. Rao Vadlamudi, is immediate past president of Indian Pharmaceutical Association and professional secretary of CRPharm Forum, and also their president of Commonwealth Pharmacists Association. Dr. Rao Vadlamudi, sir, it is you please share your screen with your presentation.
Thank you, Dr. Narayana, and thanks for the opportunity given to me. Now comes, another topic: digital health to fight substandard and falsified medicines. The issue of substandard and falsified medicines is not, relevant today, but it was relevant several years ago. And I do recall when I became the president of Indian Pharmaceutical Association in 2014, the first activity that I was involved as a part of IPA and as a part of CRPharm Forum is an initiative which is driven by FIP, CRPharm Forum, and WHPA, that is World Health Professional Alliance, with support from Pfizer. We looked at the issue of how predominant are substandard and falsified medications within India. And the research work has led to publishing a practical handbook on spurious drugs in collaboration of three organizations in India, that is the Indian Medical Association, Indian Pharmaceutical Association, and Indian Nursing Council. And that handbook is very much available on the website of Indian Pharmaceutical Association, that describes, how exactly, what are the various steps taken, how the pharmacists can be trained to identify substandard or falsified medicines. Or globally, one initiative that would prevent the infiltration of counterfeit or substandard or falsified medications into the supply chain by unscrupulous people is that track and trace initiatives. To track and trace, you're required to do serialization. So that means each medicine that is packaged needs to carry a QR code or a barcode. When you read it, that gives the entire information about where it is manufactured, where it is produced, and where it is being transported. And within India, the track and trace initiative, particularly taken up by the Ministry of Commerce, because it is directly impacting the medication export out of India, because various importing regulatory agencies of importing countries made the requirements that how this needs to be labeled and the barcodes printed on tertiary packaging, on secondary packaging, to establish a parent and child relationship, etc. And all the Indian pharmaceutical companies that are involved in export have started to fall in compliance with those importing country requirement, and government also on its side is creating a portal, where export of drugs from India and its authentication, people can do scanning of the barcode and then submit the data to the portal and they get the information. This is an initiative driven by the government of India, Ministry of Commerce and Department of Pharmaceuticals. But Ministry of Health is more concerned about the impact of spurious or substandard medications on domestic market. So those are the drugs used in the domestic market. And so the Central Drug Control Standards Control Organization, CDSCO, developed an online portal called DAVA, DAVA, that is Drug Authentication and Verification Portal, Government of India, such that if there is a barcode and in any shop, if you read that and submit the data into DAVA portal, you would get the authentication. So this is how digital interventions can prevent substandard and falsified medicines, but it's easier said than actually understood, because right now both the portals are work in progress and one is not functional, and you don't really have any way you can read a barcode in a pharmacy when you go and purchase a medication. So these are, they give rise to the barriers and challenges. So in the next slide, I've listed some of the barriers and challenges for this. The primary challenge that whenever I talk about pharmacy profession in India, I have to mention that there is need for a pharmacist behind each prescription dispensed, and many involved in dispensing medications. I'm saying many involved in dispensing medications. So they need not be pharmacists, maybe trained pharmacy assistants. They are ignorant about substandard and falsified medication. So there must be an education of how to identify the substandard and falsified medication. Is that easy? Probably you need to build mobile apps or online tools to authenticate medicines while dispensing. So you can just scan that and then you get the information. So you can tell the patient saying that this is authentic, But do we have such things in India? No, this can only be talked about, These devices must have connectivity with the online portal set up by the drug regulator. So these are all the barriers and challenges. Even if you have connectivity, if it is not connected, because there are many things done online. I'm just go off the track and say that, air tickets, travel bookings, everything. But sometimes you are standing and then they say computers are down, so I can't give you the information. It's slow. So these have to be overcome, particularly when you require that type of authentication. Implementation of track and trace for domestic medicines is a humongous task, because pharmaceutical industry in India is very large. It is very, very bifurcated. It is very, heterogeneous. There are small companies, micro companies, medium scale companies manufacturing medicines for domestic use, in addition to large and multinational companies, and all of them to implement these barcoding system on secondary and tertiary packagings, or even primary packagings. Government of India at one point say that, no, even primary packaging should have a barcode. That's easier said than done, because barcoding a primary packaging means you have to change your production lines and packaging lines. And sometimes for small companies, changing that is not easy. So, there are so many practical problems implementing. So all these things, they, form the barriers and challenges. So what could be the drivers going forward? Because you can always, picture this is tough going ahead, and then it's not going to work. It's easy to say that, but we as professionals involved in professional organizations have to understand the problems, the challenges, and suggest solutions which could form drivers to put this in. Hands-on training for pharmacists and pharmacy assistants to identify substandard and falsified medicines is the first thing. And it's better to incorporate that in the curriculum. Just like Dr. Narayana indicated, saying that we have to do all of that digital health into training, a part of curriculum. This also has to become a part of curriculum. Developing user-friendly mobile apps and detect spurious and falsified medicines and integrating those with online authentication resources. Now, earlier I said this is a challenge, this is a barrier, but now I'm saying that we have to develop. Indonesia has given a very good example of how they can develop some mobile apps and make it available to the regulators or pharmacists. Same way, the professional organizations or private industry can create this. There's one more thing, develop handheld testing devices to test authenticity. There's one other thing, what we have learned when we did this, what drugs are usually falsified or counterfeited are those with large market, large prescription base, those drugs that are highly sold. Because for anybody to introduce a counterfeit for a drug that is not really sold, it's not beneficial. So they always choose those drugs that are highly sold. So there may be a handful of ones that are frequently falsified or frequently substandard drugs are products are introduced into the supply chain. So you need to have devices that would test, those medications essentially. And government has to frequently test and at random test and find out which are substandard and then give notification saying that these are substandard and these are pulled out, So this should become a very, very frequent activity in order to prevent, and this information should be available to all pharmacists, and pharmacists can immediately transfer that information to the patient. So this is some of the drivers that can really utilize digital health to fight substandard and falsified medicines. I can talk about this for more time, but for the paucity of time, I think I have to stop here and thank FIP and the organizers for giving this wonderful opportunity for me to express some of my thoughts. Thank you, and over to you, Dr. Narayana.
Thank you, Dr. Rao, for the wonderful presentation, mentioning the scenario of India and in giving information about the intensive work done by FIP, CRFORM Forum and WHPA, and published the handbook with the help of all the medical council, nursing council, pharmacy council. And as Dr. Rao mentioned, the barriers and challenges, no doubt it is the biggest challenge because there are nearly 80,000 plus formulations are there in India, and more than 35,000 industries, both big players and small players, are manufacturing into the manufacturing, and there is a lot of barriers and challenges. But thanks to the Central Drug Control Standard Organization, they have come out with track and trace initiative that was discussed in the last meeting of the Drug Technical Advisory Board, which was approved by the Ministry of Health, and it is forwarded to the Ministry of Commerce. The good initiative has been taken in the track and trace initiative. That's what input has been given by Dr. Rao Adlamudi. This is the they started in digital health to fight substandard and falsified medicine, no doubt in it. India is in a bit ahead and compared with the other countries also. Thank you once again, Dr. Rao. And now I request the next speaker, Ilwan Yuda Teruna, Indonesian Pharmacists Association Vice President, to give his presentation on digital health to fight substandard and falsified medicine. Yes, it's your turn, Ilwan.
Thank you, Dr. Narayana. I would like to say that what happened in Indonesia is still also the same with the India. But before that, I would like to mention this authoritative institution who control the medicine or drugs. First is General Directorate of Pharmacy and Medical Supply, Ministry of Health and in Indonesia, which is technically unit in issuing licenses. The second is National Agency of Drug and Food Control, supervising product. This reporting system can be conducted by visiting website on the ulpk.pom.go.id upon mobile apps and also hotline. This initiative derived from the government actually, and then we in Indonesia also has what so-called online single submission system, which is to be implemented in registering drugs or medicines and also controlling this step of production of drugs in Indonesia, including the traditional medicines. And the other, we have the Indonesian Pharmacy Association, who has control in supplying professional pharmacists data and a system called SIAP or SIAP for reporting members' daily activities, including their finding and substandard and falsified medicines. So we can trace actually the counterfeit product or substandard product or falsified products by reporting the problem in BPOM using apps, hotline or whatever. And also you can report the problems using the apps developed by the Indonesian Pharmacies Association. Based on those system that we can report, so we currently also develop more or bigger apps using the mobile apps. Now is being developed. Hopefully sometime on October will be published to our members so they can report many things just using their fingers at any time, doesn't need to open the computer. Please slide. Now I would like to talk about the barriers and challenges. What's the barrier in challenging? In Indonesia actually has released the Bill of Electronic System and Pharmaceutical Services since March 21st in 2020, in which drugs and medical supplies can be sold online. You can visit the psef.camcast.go.id. By formally introduce the electronic system in Indonesia, meaning that only registered apps can be supply the products. The biggest problem previously was counterfeit product that can be found in street vendors. So you can find anything in any corner of the road with very cheap price of the products. So there is no guarantee that the product is original or not substandard or counterfeit product. So by formally introduce the PSEF, so many company now registering their pharmacies, their application to deliver this product. So this challenge actually, the barrier to mobilize digital health intervention, because the lack of people general knowledge in getting online products from unregistered agents. So this what I meant before. That's when you got the good knowledge in getting what the best product and in which the formal online shop you can get the better products actually. As you also know that, as I mentioned before, that we have more than 16,000 islands. It means that we have more than 100 ports in Indonesia. What does it mean? It means that any counterfeit product, any substandard product, or any falsified product can be imported from illegal ports, not just legal port, but illegal ports as well. So we are facing this problem for many years actually. Unfortunately, many of our neighbor countries also produce those kind of products. As Dr. Rao mentioned before, that they can be produced by a small business. So meaning there is no control at all for the quality of the product. So many illegal online shop is with the inexpensive product become a big challenges as well. In Indonesia, we have Minister of Communication and Information. They mentioned to us that when we invited them to discuss about this illegal shop, especially who sell the medicines, they mentioned that every day they close more than 100 online shop, but the next day they will open again with different names and with different registration, and more than 100. So that's what happened in Indonesia. But we know that the big challenge for us is to educate people how to choose a good product by visiting a good or well-known online shop. Next, please. Now, to answer this question, integrating and mobilizing digital health intervention can be enabled and derived through collaboration of all stakeholders, including government, industry, distributors, healthcare facilities, and pharmacies association. We already have a good connection with the government of Indonesia in this, especially for the Ministry of Health, in which our data can be shared with the government in Indonesia Minister of Health. So we guarantee that our pharmacists who in the association is very professional standard. And the second one, some approaches in fighting substandard and falsified medicines should be a comprehensive regulation and law enforcement. This is a big challenge actually. The regulation comes always late, like I mentioned before, the electronic services for delivering medicines, it just released this year. As you know that the online shop, it's happened for many years back. Now we have to compete with them with the new regulation. Now we also in the Pharmacies Association establishing communication with some of the provider to give to make online shop by providing pharmacists professional to them. And the second one, promotion of illegal online providers. Yeah. So promotion of legal online providers. It means that we have to make flyers, brochure, or even educate people. They have to choose the legal online shop to get the medicines. The other thing is limiting importing ports. This is what happened, as I mentioned before. The challenge for us is there are too many ports in Indonesia, more than 100 ports, because we are facing to Malaysia, facing to Singapore, Thailand, Brunei, Papua New Guinea, Australia. So we have so many ports. That's possible they get from the illegal ports as well. Slide, please. Now, I would like to introduce a little bit about the Indonesian Pharmacies Association. We have the database and application, what's so-called SIAP, SIAP, Sistem Informasi Apoteker. We have now currently approximately 86,000 members with 34 provincial offices, and we have 514 regencies offices in which they are all connected to our system. So this been developed since 2018, and then just this year we got the ISO certificate for the system security system for the SIAP. Next, please. And this will be, next slide, please. This will be the last slide. Actually, I would like to show you 5 pillars in Indonesia Pharmacists Association. We have responsible practicing pharmacies, organizational quality, pharmacist branding, pharmacist education, and regulatory quality. These 5 pillars has been established for the last 4 years successfully, actually. I think that's all from me. Thank you, Dr. Narayana. Back to you.
Thank you, Hilwan, for the wonderful presentation, giving the scenario of Indonesian pharmacy scenario about this falsified and substandard medicine and what are the challenges. Okay, we will sum up in the end. Now we are running a shortage of time, and I'll go and invite the next speaker is Dr. Chinta Abeyewardene, who is the past president of Pharmaceutical Society of Sri Lanka. Not only this, she is also past president of Seer Farm Forum. And I request Chinta Abeyewardene to give her presentation on this substandard and falsified medicine, impact of digital health. Over to you, Chinta.
Yeah, thank you very much, Dr. Narayan. And also thanks to FIP for organizing this webinar, which is, I think, very timely effort as far as Sri Lanka is concerned. Actually, if I answer the question directly, there are no digital interventions currently in place in Sri Lanka. Now, as you know, Sri Lanka has undergone several problems during the past after COVID-19 pandemic. Now we are undergoing a political as well as severe financial crisis. So this is under this situation, and now we are functioning. So I think under this background, so it is very timely effort for organizing this event. The National Medicines Regulatory Authority is the responsible, organization for regulating medical products. And in 2019, on the invitation of the Ministry of Health, so WHO did an assessment of the regulatory functions done by the NMRA, that is the National Medicines Regulatory Authority of Sri Lanka. And one of the things they have identified was the market control system in Sri Lanka is not that good. So they have made some recommendations, as Dr. Rao mentioned, to have a unique identification number on the outer packaging, that is some kind of serialization to identify whether the products are authentic. And it is good news that Dr. Rao said in India, the manufacturers are required to do that when they export products from India, and a lot of products we are getting from India, so that's some good news for us. And also we have a good, we don't have a good reporting system, so that is also one of the recommendations by the WHO in the assessment, to improve the reporting system, that is a rapid alert system or some kind of a system to get that information through the, to the required people. Can I go to the next slide, please? Next slide, please. Yes. So talking about the barriers and challenges. So there is a lack of awareness about, in the first place, about the SF product, that is substandard and falsified products. Lack of awareness among the health professionals as well as the general public. So the consequences of these products are not known to many of the people, including the health professionals. And on top of that, poor knowledge on how digital health can be used to fight SF products. Also, we don't have a good idea in Sri Lanka. Also, as I mentioned to you before, there is a poor market surveillance or market control system. We don't have inspectors at the ports of entry, and that also one of the recommendations, to check the consignments that are coming to Sri Lanka. The other thing, Sri Lanka is not a pharmaceutical producing country. It's only, we produce only about 15% of the requirement, that also only oral dosage forms. So we solely depend on imports. Most of the products, 80%, 85% like products we are importing into the country. So it's very essential that there should be people checking these consignments to identify these substandard and falsified products. So those are some of the barriers. Can I go to the next slide, please? So what are the drivers? Talking about the drivers, now because of this assessment done by the WHO and various programs are conducted, so now NMRA, National Medicines Regulatory Authority, has identified this as a priority area. So they are working on it. So that is one of the drivers. Also, in this year, we have organized, the WHO has organized a system to educate them, to establish system to fight SF products, and that is going to be initiated in this October. That is in another month's time, there will be a program for that. So in addition to that, we know that there is a Ministry of Health has, this National Medicines Regulatory Authority is also coming under the Ministry of Health, whereas Ministry of Health has a separate unit for health information that includes digital health also. So another driver, this could be further expanded to cover the market control activities of the Medicines Regulatory Authority. So those are some of the drivers. Next slide, please. So under the prevailing economic crisis situation in Sri Lanka, there is an increased demand and there are supply chain interruptions which offer opportunities for substandard and falsified products. So there is a shortage of essential medicines. During the pandemic also, we faced this situation because Sri Lanka has to depend on imports. Then on top of that, large stocks of donations are coming because we are undergoing this financial crisis. So donations means people try to donate, various organizations, sometimes government to government government donations, sometimes some of the, the ministers, they get donations. So various routes are there for these donations. But there is there is a policy, but it is not strictly implemented, this policy for accepting donations. So that means whatever comes to the country, we have to accept like that. The main thing is sometimes there are politicians are involved in this. So there is some kind of, the NMR is not, National Medicines Regulatory Authority is not fully, they don't have the full freedom to select and take over whatever they want. So the other things, when these stocks arrive in Sri Lanka, they need quick customs clearance because of the demurrages they have to pay, and also because the end users are waiting for these stocks, they need to be quickly dispatched to the end users. And these are sometimes most of these products are coming from unregistered sources. That means the companies, which are not registered in Sri Lanka. Sometimes, even if those are not registered, if those are coming from reputable suppliers, that's okay. But sometimes we don't accept some specifications, some combinations, which are not acceptable to Sri Lanka. Those are coming in with the donations. And Sri Lanka is an island in the Indian Ocean, and smuggling is another thing. And smuggled products are also without coming through the regular ports. Next slide, please. So the instances where digital technology could be used. So in training of NMRA inspectors, National Medicines Regulatory Authority inspectors should be trained. And they have to work with the customs officials. And there is a initiative with the World Customs Organization for the NMRA to train the custom officials to fight these SF products. Then conduct training and sensitization of customs officials and encourage NMRA inspectors to visit ports of entry. Now they are not, we don't have inspectors at the ports of entry. So that is also one of the recommendations of the WHO, to have inspectors at the ports of entry to check the, consignments. Then there is a procedure, initiated for handling complaints and on reports of substandard and falsified medical products. So these procedures should be now finalized and implemented. And also existing forms for healthcare professionals to report. Because there are forms, those are mainly for adverse reaction reporting. So it has to be extended to the safety and quality. Problems also to be reported to the NMRA. So those are some of the other initiatives. And also to ensure that people are aware, health professionals are aware these forms and there are these reporting channels. That is also one of the important things that NMRA, National Medicines Regulatory Authority, has to do. Also to have adequate communication and engagement with all stakeholders. We have to have awareness campaigns through social media. People should be made aware of these things. So that is also one of the important things that where digital technology can be used so that there will be proper reporting system. So that's another thing we can suggest. And also I can mention here what Dr. Rao and Dr. Hilvan mentioned certain things. I think those are also complementary to Sri Lankan, what I have mentioned here. Next slide, please. I think, thank you. That's all I have to say. So this is the situation in Sri Lanka. once again, I'm thankful for organizing this because this is very timely as far as Sri Lanka is concerned, because we are undergoing this crisis situation now. Thank you very much.
Thank you, Chinta, and thanks for updating the information. And I hope soon the Sri Lanka will come to normal, new normal. That's what we expect. We pray that. And now coming to presentations, all the three has been wonderful presentation, and with the suggestions, and in this our Hilwan has given wonderful insight about the app they are using for reporting the substandard and falsified medicine. All the pharmacies they are ahead when compared with other countries in C region, and he has informed about the challenges, because the no doubt in it, the online medicines, online selling of medicines going to create a lot of problems, because the medicine is manufactured in one area and it is sold in one area, and there is no regulatory control. The drug inspector or a regulator, if you want to seize the substandard and falsified, he has to go to the place where it was manufactured. So there are so many complications are there in this because of this online. And 1 million pharmacies are there in India. Hardly there are 2,000 regulators are there who are going to inspect. Lack of manpower, lack of trained manpower. That's what the scenario from the government point of view. And illegal online shops, there is one more thing, that chances of entry through the ports in country like Indonesia, that is observed here, but illegal online shops were not existed in countries like India and Sri Lanka, and because of the entry, that restrictions of the customs and all these loopholes may be creating that area. And Sri Lanka, no doubt, because they don't have any manufacturing and all, only everything is, they depend on the import of the drugs. So it is easy for them to find out or monitor the substandard and falsified medicines, because when you are importing a drug, government have their own restrictions of all these norms and conditions to fulfill. And she has given, Chinta has given role of the National Medicine Regulatory Authority, NMRA, and with coming out with unique identification number, which prevents this usage of digitalization in substandard and falsified. I think now I will give the floor to Shirley. Shirley, please.
Thank you so much, Dr. Narayana, and thank you so much as well for all of our speakers today and our panelists today. Thank you so much for providing your input on the ongoing initiative in the country, and also to provide some information about challenges and also about the barriers. And also thanks to all audience today who also provided some insight to us as well. So thank you so much all. I can see from today's discussion some key points, basically partnership, which is one of the common themes that happens for the substandard and falsified, and also for the medication adherence, or the importance of partnership and stakeholder engagement. So yeah, and again, thank you so much for Dr. Narayana for moderating these events, and also for speakers, panelists, and also the audience. And I will close this session by announcing our next FIP events in Seville, which I'm sure that most of you perhaps already know about this. And we are excited to invite you to this FIP World Congress in Seville. And this Congress will take place from 18 to 22nd of September under the theme of Pharmacy United in the Recovery of Healthcare. And registration is already open. And for more information, check our website, seville2022.fit.org. And we look forward to meeting you all there. And if you have any question, feel free to let us know, and don't worry to get in touch. And if you would like to know more about FIP digital events, do check out in the events.fit.org. Thank you very much, everyone, and have a lovely day to everyone. Thank you.
Thank you,
Thank
Shirley.
you. Bye.
Thank you, Dr. Rao. Thank you, Ilwan.
Thank you.
Chinta.
Thank you, Dr.
Thank you,
Nara.
everyone. Bye.
Let us meet in
Thank you,
Seville.
Dr. Marina,
Yeah,
Dr. Hilwan, Dr. Rao,
Let's meet in Seville.
Dr. Kelvin.
Shirley, thank
Have,
you.
Yeah,
have
coming
fun
in
in
Seville.
Seville. Have
Yeah.
fun in Seville and say hi from me to everybody there.
Yeah.
Okay.
Yeah, will
See
do.
you there.
Studio
Dr.
news
Rao.
with you.
Jai Surya.
Thank you very
See you.
much, everyone.
Thank you,
Thank you, Dr.
everyone.
Hello,
Have a
man.
good day.
Hirwan. Nice
Bye,
meeting you.
Farah.
Nice listening to
Thank
you.
Thank
you.
you, bye.
Thank you. Thank you. Bye. Bye.
Bye.
Thank you,
Bye.
Thanks,
everyone.
Farah.
Thank you,
Alvina,
Farah, for
saya
calling
berhutang sama Alvina ini.
Thank you so
Thank you,
much.
Chris.
Iya, Pak. Terima kasih, Pak,
Bye.
sudah hadir.
Bye.